this is Dr. Manisha. I am currently working as a medical lead in Medical Affairs Division of Lupin. I extend a warm welcome to all of you in this brief discussion on patient awareness program for patients of PCOD and mental health diseases. So as we all aware that we are celebrating PCOS Awareness Month of September. To spread the word from eminent experts, we generally conduct such kind of meetings. And joining with me today are Dr. Monica, who is very well-known psychiatrist, and she will be taking us through important aspects related to this program. So, ma'am, welcome.
Thank you so much for such a warm welcome.
Yeah, thank you, ma'am. So here we'll start the program here. So basically, we all know that PCOD is a very complex disorder and it affects the hormonal balance of women, which actually gives rise to many diseases, not only at the level of person's health, but also the emotional aspect is also affected. So is it true that PCOD affect the mental health and how does this actually correlated?
Yeah, it is true that PCOS does affect the mental health of the women. Firstly, I would just like to brief a bit about what is PCOS. Since we are celebrating this awareness month in September, there are two terms that I would like to inform you about. There is something called as PCOD, and then there is this thing PCOS. They are used interchangeably, but they are two different things. Where PCOD, we see that there are cysts in the ovaries, which are diagnosed by ultrasound. Whereas PCOS, it is a hormonal imbalance condition. It comes under PCOD. It comes under the umbrella of PCOD only, but in PCOD, mainly you see that there are cysts in the ovary which are diagnosed by ultrasound. Of course, there are other issues in PCOD also. There are hormonal imbalances, there are irregular periods, there are fertility issues, there are other symptoms associated like acne, hirsutism. But that in PCOS, mostly we deal with the hormonal imbalance. There is also increased risk of insulin resistance and other comorbid medical illnesses like cardiovascular diseases and diabetes. Now, as we were talking about that, what are the various mental health issues that are associated with this disorder? Mostly that we see in our clinical practice that women come with the problem of depression, anxiety, certain kind of eating disorders, and stress. These are the most common mental issues that we encounter.
Okay, thank you, ma'am, for this elaborative, explanation how PCOD and how it is different from PCOS as well, and how it is correlated with the mental health diseases. So, as we are aware that even PCOD have mental health illnesses, and it may be there are chances that it may get overlooked and left untreated, and it is very difficult to identify this problem also in patients. So, can you help us to know what are these common signs and symptoms that help indicate that the patient should need some help from a mental health expert?
See, the most common mental illnesses that we encounter, as I already discussed, is depression, anxiety, and eating disorders. So, symptoms of depression like sadness of mood, irritability, lack of concentration, uh, letharginess, fatigability, decreased sleep or increased sleep, eating too less or eating too much, sense of worthlessness, hopelessness,
Right.
pessimistic views about the future. These are the signs and symptoms of depression. So if you see this in your patient, in your relatives, that the person is for 15 days, this warrants a psychiatric consultation. Apart from this, symptoms of anxiety, such as excessive worries, feeling keyed or over the edge all the time, feeling restless, ghabrahat, having palpitations, sweating, tremors. numbness, tingling sensation. All these symptoms are of suggestive of anxiety disorder, and again warrants a psychiatric consultation as soon as possible. Apart from that, certain eating disorders like binge eating disorder is commonly encountered in patients of eating disorder, since they have this problem that they tend to gain weight because of the hormonal imbalances. They tend to gain weight and they have difficulty in losing it as well. This leads to psychological stress, which leads to overeating, and thereby it is a vicious cycle. So this leads to increased food intake and eating disorders, perhaps. So yeah, mostly these are the problems.
Okay. Yes. Yes, absolutely, ma'am. Thanks for sharing this information. So, as we understand, like, these are very common signs and symptoms generally patient presents with PCOD, and some like inclined towards going some affection related to mental health illnesses or symptoms. So, is there any management available for this? It is a kind of, ray of hope for our viewers also, if such kind of, such conditions can be managed, that will help them to improve their outcomes in future.
Definitely, the condition is manageable. Firstly, I would also like to tell the prevalence rate. You see, every one lady in 10 suffers from this condition. So the condition is definitely happening in vast majority, and it does deserve attention and focus. So we need to follow a multidisciplinary approach, wherein we need a setup where we have an endocrinologist who would manage the hormonal part. We need a psychiatrist who can help the patient in dealing with the mental health issues. We also need a gynecologist so as to manage the gynecological part related to the disorder, and also we need a team of nutritionists who would advise what kind of food the patient needs in order to maintain the manage the hormonal levels, the insulin resistance. So this is actually a teamwork of which is to be dealt by an endocrinologist, a gynecologist, a psychiatrist, and a nutritionist. Talking about my entity, which is psychiatry, how can we deal with help our patients in dealing with this condition? The first thing being the psychoeducation. We need to psychoeducate the patient about what is this condition actually, and telling them the signs and symptoms, the management strategies, telling them that yeah, there is hope, and psychoeducating regarding the physical condition and also the mental health issues, because at times the patient is not able to correlate that uh, this problem of mine can lead to depression. So we have to tell them that yes, this is very much possible. The symptoms of anxiety could be secondary to PCOS. So that is why controlling, managing the symptoms of PCOS becomes important for the patient. The second thing is psychotherapy. We need to teach the patient the cognitive behavior therapy or dialectic behavior therapy in order to manage the emotions well, in order to deal with depression, anxiety, and stressful conditions, in order to develop better coping strategies, and to improve the self esteem. We need to teach them various psychotherapies also. Apart from the psychological management, we can help the patient with certain medicines, like if the patient is having depression or is having anxiety, then it could very well be managed by use of antidepressants and anti-anxiety pills. Apart from that, you see, equally important is the lifestyle management. So we have to encourage the patient in doing regular exercises, in maintaining the right kind of diet, in taking a balanced diet, in also practicing various stress reduction techniques, like practicing yoga regularly, doing pranayama breathing exercises, and maybe engaging in some or the other kind of physical activity, maybe in investing some time in sports would also be good in managing the weight and thereby even lowering the stress levels. Apart from this, various hormonal support hormonal therapies can be provided, which can be dealt by the gynecologist, but offering pills like OCPs might also help, which they can further discuss with their gynecologist. And also, the last of the strategies would be the support groups, like in the common platform, like on social media, they they can form groups and they can share views on the communities with people who are suffering from the similar kind of illnesses. Helps.
Yes, yes. Thank you, ma'am. Thanks a lot for sharing this information. Now, at the end of this session, actually, this program, I will, before wrapping up, so can you tell us briefly how we can actually advise to our viewers on importance of regular mental health checkup and early detecting these signs and symptoms?
Yeah, see, most commonly what happens is our friends, our colleagues, they start telling us, they become the primary focus of our consultation. They are the immediate help, right? So if they are misinformed, then the patient will be misinformed. So this program like these become an awareness strategies for all of us, wherein if like the signs and symptoms that I just told of depression, anxiety, if the patient comes up with such symptoms, if the patient discusses these symptoms that I'm not feeling good, I'm feeling irritable, or if you observe these symptoms in the patient that the patient is unusually irritable, is having lack of motivation, etc., is experiencing abroad anxiety, then it becomes their dire need then that they should immediately bring the patient to the mental health professional as early as possible, because if these symptoms are not dealt at on time, then the prognosis of the illness also worsens. The effect that the antidepressants give as soon as the symptoms arise, and if we provide them the treatment, the outcome, the prognosis of the treatment improves. So the delay is not the rule. Don't overlook these symptoms that they will improve by themselves, or this happens to everyone. Do not unusually delay the symptoms. If you have any confusion, do take the patient to a mental health professional so that they could be guided thereof.
Yes. Yes. So, as we have come to end of this program, I would like to take a moment to express my heartfelt gratitude uh, to Dr. Monica. Thank you, ma'am, for coming here and sharing this information with us. I'm sure that our viewers and some of our patients with PCOD who are viewing this program will definitely benefit out of this information and the insights what you have shared. And it is easy and easily manageable condition. It is not that it is very difficult with the help of only medications can improve it. There are other ways also to improve it with the help of lifestyle modifications and other psychological consultation. Thank you, ma'am. Thanks a lot. So here we'll end the session.